How long do the brachytherapy seeds work?
So the brachytherapy seeds are multiple different type of seeds. There's iodine, palladium, and there's cesium. The
Okay.
half-life varies between those seeds. So for cesium, the half-life can be 9 days. For palladium, it can be 17 days, and for iodine, it can be about 60 days. And what we generally communicate is that each of the isotopes takes 5 half-lives for all the radiation to be gone. So from a intensity of the treatment, about 75% of all that radiation is delivered within 2 half-lives. So for a patient, they might have symptoms shorter for a shorter half-life than the longer half-life. So what I typically do with the isotope that I'm using like now, I use it depending on the symptoms of the patient, the stage of the disease, and we use all 3 isotopes, whether it's palladium, cesium, or iodine. Palladium is one that I've been using for the boost because it's nice from the standpoint that it's 17 days, and by 3 months, all the radiation is completely gone. For some patients, they might have young kids. They
Yep.
might not want to have the radiation as long, and so cesium is nice because I can go ahead and deliver that radiation faster with cesium. And then there's some patients that need a little bit larger margin, and the energy level with iodine is optimal, and there's less acute effects because we're able to deliver that radiation over a little bit longer period of time. So each isotope has different energy properties and physical properties that help me gauge what is going to be the best for that individual patient.
The brachytherapy seeds stay in though forever for the rest of a person's life.
The brachytherapy seeds do stay in there for the patient's entire life. That's correct.
And there's no harm long term for that.
There is no. There's no
Okay.
long. It stays in there. It sort of just sits inside the fibrotic tissue that was the
Okay.
prostate. I put them in strands, and so they stay and they stay fixed, and there's no effect on the patient or anyone in their families.